Welcome to the SUNY Sullivan Podcast, where we introduce to you the people and the stories that help make our campus Sullivan strong. I'm this week's host, James Faraci, majoring in media arts. And today I am here with the head of the nursing program, Dr. Chyrise Taylor, and one of her best professors, Karen Faraci. Welcome to the podcast, and thank you for the time for being here.
My name is Dr. Chyrise Taylor. I'm the director of the nursing program here at SUNY Sullivan.
I'm Karen Faraci. I'm a registered nurse, and I'm one of the nursing instructors here. I manage the lab.
And yes, the theory of relativity is in play here because she is my mother. All right, thank you both for taking time out for being a part of this podcast. Now, the two of you have worked in the nursing education program, which has become one of the most successful programs in this college. How much more growth do you see coming?
I see tremendous growth coming. We have 2 new cohorts that we hope to be introducing to extend the program by another 50, 60 students. So I see tremendous growth coming.
And I also see tremendous growth within the lab because we are using the mannequin simulation in more useful ways.
Do the hospital staff assist with the clinical, or do they allow you the leeway to be able to allow the students under the supervision of the educational leader of the clinical portion to actually interact with the patients at the hospital?
We have many places where we have clinical. We do have clinical adjuncts, which are hired by SUNY Sullivan. However, and those are in hospitals. In hospitals, you must have a faculty member from SUNY Sullivan present. However, we also have clinicals in ambulatory medical facilities like Sun River Health and Center for Discovery and ARC and New Hope. And at those facilities, and I say Crystal Run, where they do not need to have a faculty member present, but they are paired with a nurse educator.
There have been technical advancements in the medical fronts. Will that have more of a negative or a positive effect on the progress of the students?
Oh, absolutely positive. Very, very positive effect on the students. The technological advances that are within the hospitals generally are administered at some portion by a nurse. So they're learning and they're growing, and I think it's only positives.
Absolutely positive. The students are getting such a varied and diverse education with all the new equipment and opportunities at any of the facilities that they work at.
How do you think the students in the nursing program will be able to help in current issues like with, say, the fentanyl crisis?
Addiction nursing is a specialty. So not only is there a specialty certification for addiction nursing, but nurses who are not specialized in addiction services can also teach the greater community on the importance of Narcan and how to administer Narcan. We can teach patients about medication safety and about disposing of medications safely once they've finished using them. So we have a very large portion of our scope of practice is in teaching, is educating our patients. And so this is a big education opportunity.
Education is always what I stress with the students. Educating your patients, educating the family, for them to learn more on how to better take care of themselves. And as Dr. Taylor said, whatever they need help with, they know how to get it.
How do you think the future nurses will deal with the progress of the medical fields? And will they be able to keep up with the ever-growing advancements in the medical world?
Nurses are constantly required to do continuing education. So as new products roll out, the vendors come into the hospital specifically to teach the nurses about them. So absolutely nurses will keep up because we are first line and we're taught right alongside our medical colleagues how to use the different equipment, what it's for, what the application is for, the kind of patient that you may see this in. So yes, we are absolutely on the forefront of learning and use of new technologies.
Definitely, we are always putting ourselves to learn more because with learning more, we can more safely take care of our patients competently and carefully.
Thank you. I'd like to thank our guests, Dr. Chyrise Taylor and Karen Faraci, for taking time from their schedule to come on and answer these questions. And for more information or to be featured on the SUNY Sullivan Podcast, please send your email to kluck@sunysullivan.edu. That's KLUCK@sunysullivan.edu.